All right, so today we're going to talk about hypertension, specifically hypertensive urgency and then hypertensive emergency. Okay, so first let's just quickly go over hypertensive urgency. So the other name is called severe asymptomatic hypertension. So what does that mean? So when your systolic blood pressure is greater than 180, and your diastolic blood pressure is greater than 120. So usually if your blood pressure is that high, but you're asymptomatic, usually you can treat it with PO meds or even some IV PRM medications, okay? The next one, so that's just a really quick, urgency, no symptoms. That's the most important key here. The next is the hypertension emergency. So what does that mean? You still have the same systolic and diastolic blood pressure here, but this also includes end organ damage. So end organ damage are multiple things. One is patient's blood pressure is elevated, plus they have chest pain, elevated troponin. This looks like ACS. Or headache, increase intracranial pressure. They're confused, altered mental status, so encephalopathy. Renal, now you see their BMP, you see they have an AKI, or if they have history of CKD, now they have AKI on CKD, noted an elevated creatinine, or their UA shows proteinuria. Abnormal retinal examination, so you look into their eyes and there's papilledema. Asymmetric blood pressure reading, so you check blood pressure on both arms. They're asymmetrical, you think of aortic dissection. Same thing with back pain. Now they're high blood pressure, they're complaining of severe back pain, so you kind of think of aortic dissection as well. Or they have elevated blood pressure. Now they have like CHF with pulmonary edema. Okay, crackles. You look at their chest x-ray, they have pulmonary edema. All right, so what I want to focus more on today is the hypertension emergency, as those these each examples will kind of go through. Okay, so first one, let's talk about a patient that comes in with hypertensive emergency. So their blood pressure systolic is greater than 180 and diastolic greater than 120, plus it looks like they have a stroke. So now with a stroke, here's the thing though, if someone has a stroke, we want the permissive hypertension. We want a little bit of their blood pressure to be elevated. However, if their blood pressure is greater than 180 to 200, you do want to reduce it by 10 to 15% in 24 hours by using calcium channel blocker or a beta blocker, okay? Now, however, let's say they have a stroke, but now you want to give them thrombolytics. To give thrombolytics, you first need to make sure their blood pressure is less than 185 systolically and diastolically less than 110 during the treatment of the thrombolytics, as well as following the first 24 hours, because that can cause a hemorrhage. So that is why you want their blood pressure low. Okay, I hope this makes sense. All right, let's talk about intracerebral hemorrhage. So now they have bleeding, basically, right? They're bleeding. So what you want to do is maintain systolic blood pressure less than 140 in the first 6 hours. And by doing that, you would use a calcium channel blocker and a beta blocker. Okay, next is bleed again, acute subarachnoid hemorrhage. So if someone who has a normal blood pressure baseline, 110 to 120, you want to just keep it to that. However, if you have a patient of history of hypertension and they come in with acute subarachnoid hemorrhage, you do want to reduce the blood pressure by 20% of the patient's baseline. So whatever their baseline is, reduce it by 20%. Okay? All right. Aortic dissection. This is what I'm talking about with the uneven blood pressure on both arms, back pain. What you want to do is, for someone who has hypertensive emergency aortic dissection, you want to reduce the blood pressure, systolic blood pressure, to less than 120 millimeter mercury and of heart rate of 60 beats per minute within 30 minutes. This one, you have to reduce the blood pressure quickly to prevent worsening of the shearing of their blood vessels, okay? The aorta. Now let's talk about cardiac related hypertensive emergencies. So acute left ventricular diastolic dysfunction, pulmonary edema, and then ACS. Now, if you have acute left ventricular dysfunction and then pulmonary edema, you want to reduce the blood pressure by 10 to 15%, okay, the first 1 to 2 hours. You want to use a vasodilator and a loop diuretic. You don't want to use hydralazine because it actually increases the cardiac workload. And you don't want to use a beta blocker because it actually will decrease the cardiac contractility. So again, for someone with acute left ventricular dysfunction and pulmonary edema, avoid hydralazine and beta blockers. Use a vasodilator and loop diuretic. Now, however, let's say they have ACS, right? ACS meaning a heart attack, myocardial infarction, okay? And STEMI, you do want to use the nitroglycerin, you do want to use calcium channel blocker, and you do want to use a beta blocker, okay? Now, let's say someone patient comes in, and they have hypertensive emergency and is due to cocaine or some hyperadrenergic state. Use a calcium channel blocker and use a benzo. Do not use a beta blocker, okay? Because what it does is it will cause an unopposed and alpha adrenergic vasoconstriction, which basically means worsening their blood pressure. So do not use a beta blocker, okay? The main point I want you guys to understand is with hypertensive emergency is do not reduce the blood pressure greater than 10 to 15% in the first hour. Then no more than 5 to 15% in 23 hours. This is super important, guys. Why do you want to reduce slowly? It's because it can cause ischemic damage if you reduce it much quicker, okay? The body is already used to a higher blood pressure because it does autoregulation. So since the body is used to a higher blood pressure and you reduce it so quickly, it will cause ischemic damage. So for all the nurses out there, when you have a patient with high blood pressure, remember this, okay? Remember this. This is very important. Do not reduce blood pressure greater than 10 to 15% in the first hour. Then do not reduce more than 5 to 15% in 23 hours. This is super important. Unless you have an aortic dissection. If you have an aortic dissection, then you want to reduce the blood pressure within 30 minutes to prevent worsening shearing of the aorta. Okay. Now, if this video was helpful, or if you want me to make a video on different blood pressure medications, IV and oral, let me know in the comments below. Okay. Thank you so much for your time and good luck.